I'm Dan from Correct Osteo Clinic, and today I wanted to talk to you a little bit about osteoarthritis and rheumatoid arthritis. So not a lot of patients know the difference between rheumatoid arthritis and osteoarthritis. So when we're going through the medical history form, we ask a little bit about family history of disorders, and some people will say, oh, my mum or my granddad or nan has got arthritis, but then obviously after we ask what ones it is it rheumatoid arthritis or osteoarthritis, they don't really know. So I'm here to sort of talk to you a little bit about the differences of each one. We normally abbreviate osteoarthritis as OA, that's how we call it, and rheumatoid arthritis as RA. So we talk a little bit about the sort of differences of each one. Osteoarthritis is more of a disrepair of the joint. It normally affects load-bearing joints such as the hips, the knees, sort of ankles, even the shoulder as well, and the lumbar spine. These big joints that are taking a lot of pressure day in and day out and are getting a hell of a lot of use day in and day out, and it normally happens, some studies suggest over the age of 40, some say over the age of 50, some even say over the age of 60 as well. It can happen also in the fingers as well. It doesn't have to just be load bearing joints. You can get it in joints that are actually overused as well. So when the hand's affected, you'll normally get the distal portion of the joints. So the ones closer to the fingertips are normally affected by osteoarthritis. Then the next joint up is normally affected by osteo and rheumatoid arthritis, and this one here where the knuckles are normally affected by rheumatoid arthritis. So that's where it is different in the hands. Rheumatoid arthritis, on the other hand, is a autoimmune disease. So the body's white blood cells starts attacking the tissues of the joint. So it's a nasty disease, really. It can be found anywhere between, well, you can actually find it even younger than 15 years old, all the way to like even 50 years old and so on like that, in even later on. So it can be sort of found anywhere in life, really, but that's roughly where rheumatoid arthritis is affected. Both of them, osteoarthritis and rheumatoid arthritis, both affect females 3-to-1 ratio more than males. So unfortunately, yeah, it does affect females a lot more than it would males. Rheumatoid arthritis, the symptoms of rheumatoid arthritis are normally pain, swelling, redness, heat around joints. So they are normally affected joints bilaterally. So when I say bilaterally, it means sort of both sides of the body. So say if you've got rheumatoid arthritis that's affecting one shoulder, you're more likely to get it in the other shoulder as well. But however, osteoarthritis can affect obviously both joints at the same time, but you're normally going to get it on one side first, and then it gradually comes on to the other side. Whereas with rheumatoid arthritis, it's just the white blood cells of the body starting to attack that tissue. So unfortunately, they've got the wrong markers on the cells where the white blood cells don't recognize it, and then all of a sudden the white blood cells will start attacking those cells that have the wrong markers on them. Rheumatoid arthritis can also be like genetical as well, so someone in the family could have it, and it could be like passed down through that. With rheumatoid arthritis, you'll normally get like a massive amount of inflammation around the joint as well. So the synovium will start getting inflamed, that's the tissue within the joint, and producing a lot more sort of synovial fluid as well, and start getting a lot of swelling around the joint. Because it's an autoimmune disease as well, you'll also likely to get fevers, fatigue, general feeling of unwellness. You can even get, with rheumatoid arthritis, pain at different parts of the body. So you can get irritability around the eyes, even the lining of the heart and the lungs as well. So it can affect even, you know, your heart. It can affect also your blood pressure and your breathing as well. It can even cause a thickening to the arteries within the body, and cause something called pericarditis. So the tissue surrounding the heart, it can also inflame that and irritate that as well. So it is quite a nasty disease, and I don't know if I mentioned earlier, but it can affect also the eye as well. All right, so whereas osteoarthritis doesn't give those what we call constitutional symptoms, that fever, fatigue, nausea, that general feeling of unwellness, it just solely affects the actual joint, but can also obviously give you pain in and around the joint as well, especially with movement or even compression of the joint, where the articular cartilage or the surfaces in the joint are starting to come together and starting to rub. So the very fine nerves that are on the end of bones are starting to sort of rub together and even get irritated quite badly from that. With rheumatoid arthritis, you get a difference. So in the morning, so you'll normally get a stiffness in the morning within the affected joint for more than an hour, whereas osteoarthritis would normally around 30 minutes or less of stiffness in the affected joint in the morning. So I think that's quite a bit about the difference between rheumatoid and osteoarthritis. I hope that makes it a little bit more clear as to what one, if you hopefully you don't get affected by both of them, but if you you think you've got signs and symptoms of one of them, hopefully that makes it a little bit clear, or even in the future for you to look out for any sort of differences in that. Okay, so if there's anything in the future, like you are worried about it, just get in touch with us. Your email on the website, phone numbers all on there as well. You can book in again for your consultation on the website also. So don't go on worrying, just give us a shout, come in, we can go through it and make sure that you're all healthy, and if needed, hopefully not, if needed, we can provide a sort of treatment plan, or even refer you to someone who can look after you if we can't. So have a good day, bye.